Hello, everyone. It is indeed the top of the hour. And as you may have seen in the video just immediately before the meeting, we will have simultaneous interpretation today. I'll share a few housekeeping items that are particular to this meeting. Today's simultaneous interpretation will be available in English, French, Japanese, Spanish, and Italian. As you saw on the video, you'll find the interpretation button in the lower bar of your Zoom interface, and you may select your preferred language from the drop-down menu. If you are speaking, please turn interpretation off so that we only hear your voice and not that of the interpreters. As always, we thank our hardworking interpreters for their contributions. We remind you that their expertise doesn't come for free, so we thank those delegations among you who support interpretation financially for these network meetings. If you're able or interested to do so in the future for your language, please do see one of my team. On Zoom, we've asked in the information note received before this meeting that you clearly label your Zoom window so that you can identify one another easily. The identification method is MP, Member of Parliament, first name, last name, and your three-letter country code. Parliamentary staff or officials who are attending should use the same format, first name, last name, three-letter country code, omitting the MP designation. Our network team will be coming through to help you change your name if you need to. If you'd like to do it yourself, you can click on the three dots in the upper right-hand corner of your own picture, click on rename, and follow the prompts.
So I would like to welcome you all and some of you back to the second day of our network meeting. This is the second full network meeting that we are doing virtually. We had a very rich discussion yesterday with the Secretary General, with the Chief Economist, and we finished with what I hope you found a very instructive session, a very clear session on the situation as regards our work on tax. As you know, we're reaching the home stretch now of our work to establish a digital tax and a minimum tax level. This is the completion, we hope, of the work of over 10 years that began with the last crisis, with the global financial crisis. And your help on that front is particularly appreciated. Now, today, we turn to the most important issue, no doubt, because we often have the privilege of saying at the OECD that we don't work on life and death issues. And unfortunately, in this instance, we are very much associated with a life and death issue, and that is the global pandemic. We've always worked on health policy, of course. Perhaps it has to do with life and death, but on a far longer time frame. But here we are very much in something where public policy can indeed and should make the difference between ultimate well-being, which is whether most of us are around following this pandemic, which is obviously what we wish. And it should be no surprise to you that we're devoting the entire day of today to the different health aspects, together with our colleagues who are working so intensely on these issues. And perhaps they're those who are being called upon most intensively in this period, and we're delighted to be able to have them share their learnings and expertise with you today, and obviously listen to yours, which has been extraordinarily valuable. Now, before we turn to our speakers and our discussants, we quickly want to hear from you, and I want to carry out a quick flash poll, if I may, and you should see it come up on your screen now. We're giving you just about a minute or so to tell us which of the following health-related issues are the most pressing in your country in the context of COVID.
Let me just start with that very, very last comment about why did some countries do better than others. There isn't one answer to this. There's at least two different answers. One group of countries did better because they did the testing, tracking and tracing vastly better than others. And that was down to a mixture of having lab capacity in place, but also being monitored centrally so it could be mobilized very quickly, but also having community health workers, which I think our colleague from Spain mentioned as being an incredibly important area that many countries have forgotten. It's been a bit different when you talk about Australia and New Zealand, who I would also say have been very successful, where they just took a very, very different strategy. They took the strategy of suppression, not management of cases. So they tried to wipe out all cases. And I think, compared with what's happened with many of our countries where we've just tried to manage the numbers, it's a much more difficult message to sell to your population because you're talking about tiny numbers of people and having the disease and yet enormous implications on everybody's lifestyles. And yet we've seen in the long run, it has been a better strategy. But lots more that can be said on that. We do have huge amounts of information about the different approaches of different countries. We'd be really happy to have more conversations about that. I think you'll hear more actually in your very next session. In terms of the comments on vaccines that everybody else has been raising, there were some very important points, I think, raised by Ricardo and Mickey around the continuing importance of exchange of information about what's going on in countries.